Hi everybody, good morning, good afternoon. So, welcome back to another episode, guys. Now, we missed out yesterday's session. So, what I've done is, am I audible and visible, everyone? Just give me a thumbs up. Okay, am I audible, everybody? Am I audible and visible? Give me a thumbs up. Okay, alright, so we missed out yesterday's class, so don't worry about it. I have shared a link of the session that we had on biostats for NEETPG Sure Shot. We had a biostat session in NEETPG Sure Shot. So since we are running short of days, I have shared the link of the same link on Telegram group also. I will try to get its PDF also so that you can go through biostats from that lecture only. It's equally, there's not too much of a difference. So let's finish the remaining chapters according to the roster, demography and all. And then if time permits us, I will make you practice biostats in a live session also. Or I can cover biostats in this numerical class. Is it okay, everybody? So just go through the link and practice that. Okay? Alright, now let's proceed to demography and so far remember one thing, LRR हो गया, Sure Shot हो गया, images, 100 one-liners, whatever you want, all the links are there and all the PDFs are available. Whatever is your source of revision, you can stick to the same. Clear? Okay, now let's go to demography. Just quickly put on the question. So in demography and contraceptives, we're going to have a 45 minutes class, 45 minutes to 50 minutes class. I have covered all the PYQs from all the different exams and certain expected MCQs. Alright. So what is the answer to this one? Write the correct sequence of demographic cycle. That's very good, Dipanshu. You've done from RR. RR is like a mini PSM course, okay, which has not missed out any of the things. So you can just keep revising. Remember, guys, Sure Shot are just revision, just practice sessions for MCQs to keep you on track, because you all know that PSM is a game changer, okay? It's a scorer. So that's what I'm trying to do over here. Okay? Now, what is your answer here? Why am I getting mixed answers? High stationary, early expanding, late expanding, low stationary, declining. A very basic question that could come in your exams. You must know these stages. So nothing to talk about much over here. This is one question that you should know. Alright, before we go to discussing of the demography transition model, which of the following is not a demographic process? This is a PYQ. This has come in NEET also, NEETPG and FMGE both. Now when I talk about demographic process, these are these are like why these are processes that govern the demographic structure of a country. Why is it that population is increasing? Why is it that population is decreasing? So the question is, which is not. So I've told you in classes also, I've told you many times, imagine a couple getting married. Okay? So the first one is marriage. Now after marriage, they're going to have babies. So the next one is fertility. Now after they have babies, they think that, oh, we are not earning a lot here. Let's move out to some other country. So what happens? Migration. Now once you migrate to some other country, you might become rich. You might become like middle से lower class भी हो सकता है. ऐसा भी हो सकता है ना. हमेशा we can't say that we're going to become rich only. So what is that, guys? Social mobility. Okay, social mobility. And ultimately what happens? Ultimately, what is it that's going to govern the population size? The death rates of a country, birth rates and death rates. So which one is the correct answer over here? Morbidity. Okay, chalo. That's very nice. PDF has been shared in the Telegram group, guys. Unannotated PDF I have just shared on my Telegram group. Link to my Telegram group is in the description box. You can check out from there. Okay. Now one more question Ames asked, guys. One more question Ames asked. The question was, what do you mean by social mobility? Social mobility क्या होता है? Movement at socio-economic level. Movement at socio-economic level. Alright, you can just remember this, like from high class, lower class, middle class, उसको बोलते हैं socio-economic level. Clear? Movement at socio-economic level. Next, let us talk about the cycles. Now, यहाँ पे line B demonstrates. So, they had marked actually 2 lines. I am marking it for you now. Although you can see the answer on the board, but this was a question, so I thought कि चलो एक बार let me show you this question. In the demographic transition model, this was the last NEET PG PYQ. ठीक है, now you can see over here it's written blue color is the birth rate, green color is the death rate, and the red color is the total population projection that the country is going to have. All right, that's total population projection. Obviously exam में ये नहीं होगा, you will not have that labeling in the exam, so I just wanted to make you practice, so I've brought that image for you. Now you all remember in the first stage births are high deaths are high, population stable. The problem is both are high, so high stationary. Then what happens, guys? If this is the birth rate, this is the death rate. Okay, now what happens? The first thing that the country would want to do is decline the death rate, make people live longer. So death starts to decline. If death starts to decline in this birth, nobody is bothered about the birth right now, birth rate. So death starts to decline, and this gap, guys, always remember what was demographic gap, guys. Demographic gap क्या होता है? डेमोग्राफिक गैप होता है CBR माइनस CDR, क्रूड बर्थ रेट माइनस क्रूड डेथ रेट. सो इन द सेकेंड स्टेज डेथ रेट स्टार्ट्स टू डिक्लाइन, बर्थ रेट इज स्टिल हाई. सो ये गैप देखो, इट वाइडन्स. ओके, इट स्टार्ट्स टू इंक्रीज. But the population is expanding at a faster rate, population explosion. In the third stage, death और कम होता है, death rate और कम होता है, and for the first time birth rate starts to decline. ठीक है? So now what happens? Population is expanding but at a slower rate. All right? In the fourth stage, low stationary, both are low. So CBR, CDR low. The most desirable stage is the fourth stage. Ultimately last stage में क्या होता है? Birth rate is lower than the death rate. Population is declining. We will never say that the desirable stage is stage 5. No, the desirable stage for any country is stage 4. And which is the most undesirable stage for a country, guys? What is the most undesirable stage for a country? Most undesirable stage, everybody, is stage 2. सबसे अनडिजायरेबल स्टेज होता है स्टेज 2. स्टेज 2 में क्या होता है? कंट्री इज ट्रैप्ड, डेमोग्राफी ट्रैप्ड, द कंट्री इज ट्रैप्ड. व्हाट इज इट विटनेसिंग? इट इज विटनेसिंग पॉपुलेशन explosion. It is witnessing population explosion. So if you look at this image, guys, it's the same thing in this stage 1, high stationary, demographic gap, everybody is minimum. ठीक है? In stage 2, this is the birth, this is this, if you look at A, ठीक है, and if you look at this one, now what is your A over here, guys, in stage, in this thing, इसमें जो A है वो तुम्हारा बर्थ रेट है, इट्स स्टिल हाई, डेथ रेट स्टार्ट्स टू डिक्लाइन. सो B मैंने पूछा था, B इज व्हाट? B इज द डेथ रेट. डेथ रेट स्टार्ट्स टू डिक्लाइन, बर्थ रेट इज स्टिल हाई. व्हेन डज द बर्थ रेट स्टार्ट्स टू डिक्लाइन, गाइज? इट स्टार्ट्स टू डिक्लाइन फॉर द फर्स्ट टाइम इन स्टेज 3. And stage 4, what happens? It is again low, demographic gap, and obviously in stage 5 it is declining. Clear, everybody? ठीक है, you should know this. One more thing, what was the formula for CBR, guys? The formula for CBR is total number of live births, total number of live births per 1000 mid-year population. Mid-year population लेते हैं 1st of July को. And what is CDR? CDR is nothing but total deaths per 1000 mid-year population. Whenever you have this word death rate, your denominator is always going to be mid-year population. Clear? Okay, I will explain to you once again. Let's do all the questions, then I'll tell you once again. I'll keep repeating the transition model. Highest birth rate is seen in which stage of the demographic cycle? सबसे ज़्यादा birth rate कब होता है? Dr. Tanma, I will explain it, don't worry. Let me just go to the questions. I'll take you to the image once again. Now highest birth rate. See guys, again, सबसे पहले highest birth rate is in stage 1. Birth rate high, death rate high, population stable, highest birth rate in stage 1. Birth rate starts to decline. When does it starts to decline, guys? It starts to decline in stage 2. ठीक है? It starts to decline in stage 3. Highest is in stage 1. Same birth rate in stage 2. Same birth rate in stage 2. It starts to decline कब? It starts to decline in stage 3. Clear? So you have to be very careful with the questions. Now look at another question. Which of the following statements is true regarding the fifth stage of the cycle? I've tried to give you all the possible questions which were asked before. Fifth stage. तो fifth stage के लिए कौन सा true है? Which of the following statements is true regarding the fifth stage? Birth rate remains unchanged. Now which is this stage जहाँ पे birth rate remains unchanged? This is stage 2 जहाँ पे birth rate unchanged होता है. Death rate increases ऐसा नहीं है. Demographic gap positive most of the place. Birth rate falls below death rate. Clear? Birth rate falls below death rate. This is which stage, guys? This is your declining phase. ठीक है? Okay, most of the certain European countries are in the declining phase. If you talk about UK, US, they are all in stage 4. India bhi aayega, I think. Yes, India has come. Identify the correct statement about Indian demography transition model. So sorry. Okay. Just a second. Yeah, what is the true statement about Indian demography transition model? What is the true statement regarding Indian demography transition model? What is your answer, guys? India किस stage में है? India is currently, everyone should know. Please remember there has not been any change in that. India is in the late expanding stage. Now what was late expanding stage? Late expanding stage is birth rate starts to decline for the first time. Death rate continues to decline. So is the birth rate lower than death rate? No, that is the declining phase. Death rate declines still further and birth rate tends to increase. नहीं, highest birth rate सिर्फ stage 1 में होता है और कहीं पे भी birth rate बढ़ नहीं रहा है. ठीक है? Stage 2 it's the same, stage 3 it declines for the first time. So ये भी नहीं. Now high birth rate and high death rate, this is high stationary, stage 1. So what is the correct answer over here? Death rate declines still further and birth rate tends to fall also. For the first time birth rate starts to fall and death rate continues to decline. Am I clear? India is still in the late expanding phase. Nobody will see any other phase. It is in the late expanding phase. Now how has this particular question come in all the exams? So in FMGE exam, guys, they asked the name of this model. What is the name of the image? I have just conducted day before yesterday image based session on Prep YouTube. Please go through it. It has all images that could come in your exams. What is the name of this image, everyone? I want the exact name of the image. I want the exact name. Very good, Shaina. Very good, everybody. Nobody will say the cycle. This is a transition model. Demography transition model. This is a model. Demography transition model. That was the question in FMG exams. In NEETPG exam, what was the question? It was labeling. It was labeling, which we have already done. Like over here, blue color जो है वो तुम्हारा, yeah, इसमें it's cut off this. If you talk about the blue color, it is death rate. If you talk about the red color, it is birth rate. Clear? Birth rate and death rate. Now what was asked in INI-CT or AIMS paper? INI-CT or AIMS paper में क्या आया? Where is demographic gap minimum? So where can you say demographic gap is minimum, everybody? कहाँ पे demographic gap minimum है? What was DG, guys? DG is nothing but CBR minus CDR. So where is this demographic gap minimum? In stage 1 also, stage 4 also. Now where does the demographic gap maximum? Where is it maximum? It is going to be maximum obviously in the second stage. Birth rate still high, death rate starts to decline. So ये gap कहाँ पे maximum हो जाता है? Late stage 2. Where is it maximum, guys? Late stage 2. When does the demographic gap starts contracting, everybody? When does the demographic gap starts contracting? So it will start contracting once the birth rate starts to decline. All right, it will start contracting. It will start contracting once the birth rate starts to decline. So when does it starts to decline? Early stage 3. It starts to decline early stage 3. And where is the demographic gap? Negative, guys. Where is the demographic gap? Negative. CBR is below CDR. So that is in stage 5. Where is it negative? That is in stage 5. Am I clear, everybody? So revision done for all the particular exams that the question could come. Okay? Now see what was the exact question in our NICT? Contraction of demographic gap starts in. So what are you going to put over here? When does the contraction of demographic gap start? Contraction of demographic gap starts in stage 1, late stage 2. ये AIMS का PYQ है, ठीक है? This is AIMS PYQ. So when does it start, everybody? It starts in early stage 3. Early stage 3 is the first stage where the birth rate starts to decline. First say, highest birth rate, stage 1. Birth rate remains the same, stage 2. When does the birth rate starts contracting? Stage 3. ठीक है? Demographic trap is stage 2. Alright, what is the name of this image? Already discussed in your image based session. So we'll just mention it once again. Population pyramid. I'll just talk about the points. It is age and gender representation or sex distribution, alright, of a population. Okay, now the first one over here is developed country, the second one over here is developing country. Okay, on the left hand side you always have the age group, so it is, and these colors denote the gender. Blue is for boys, pink is for girls. Now we have childhood, we have working class, and we have the elderly population. This one narrow base because fertility is less, birth rate is low. This one broad base because more fertility, more higher birth rate. This has a obtuse apex. Obtuse apex, why? Because if you talk about obtuse apex over here, guys, so it has a obtuse apex because more elderly people are living longer. This one is a taller pyramid. There is more life expectancy. Here it is acute apex. People are living, people are living, like the old age population is less. ठीक है, लो लाइफ एक्सपेक्टेंसी. ये किस शेप का है? स्पिंडल. इट्स लाइक अ स्पिंडल शेप. What is this? This is like a triangle going upwards. Okay, not downward triangular, upward triangular. This is a upward triangular. ये pyramid is kind of expanding like this. Okay, this is written expanding type. This is constricting type. So you could be asked any question from population pyramid. Be very careful. I'm sure you will be able to answer it. All right. Let's discuss a couple of formulas from here. While conducting a study in town, CBR was 32, CDR was 21. What is the current annual growth rate of the population? Can you tell me? Question दिख रहा है? क्या है आंसर इसका, गाइज? सो इफ यू गेट अ क्वेश्चन लाइक AGR, actually no, because we have annual decadal growth, like we have annual growth rates. So इसमें हमें क्या करना होता है? AGR actually is your CBR minus CDR. ठीक है? Now over here 32 minus 21 and we always divide it by 10. So over here it is 32 minus 21, 11 by 10, which is 1.1%. ठीक है? It is 1.1%. 1.01 तो नहीं है, it is 1.1%. Just know about this formula. Okay, if you get a question to calculate AGR and if you give it in percentages, you have to go and divide it by 10. Clear? That is annual growth rate of a country. Alright, let's go to the next question. In India, cause of death is noted by. This is a UPSC question, but it is a very, very beautiful question. So I thought I will discuss it once. SRS, what health information system tells you about the cause of the death? Okay, is it SRS? Is it census? Is it death declaration medical certificate? Is it lay reporting? What is your answer over here? What is your answer over here? SRS, All right, so Love has come up with an answer. Suvarna, everybody, yes, SRS definitely. Sample registration system is the most efficient health recording system. Okay, abhi we'll do question on it. It does tell us about the cause of death. Census cause of death nahi batata. Census tells us about population structure, the demographic features. This you have studied in forensic, death declaration, medical certificate. Of course, it tells us about the cause of death. What is lay reporting? Lay reporting is done by health workers in the field. Lay reporting is done by health workers in field to know cause of death. Alright, to know cause of death. That is done by health reporters in the field to know cause of death. Okay? So over here the correct answer is 1, 3 and 4. Census cause of death nahi batata. Lay reporting mein we also rely on a technique which is known as verbal autopsy. We are not going to go into too much detail of this term, but of course verbal autopsy is trying to find out about the cause of death by asking. Lay reporting yaad rakhna, it is being done by health workers. Clear? Everybody's census आपको नहीं बताता है. Okay, now health information system, let's do a couple of more questions. Dual recording system will provide data on, this is also a PYQ. Dual recording system, कौन सा है dual recording system? Which one's dual recording system, guys? Good. Dual recording system क्या है? Dual recording system is your SRS. Sample registration system. Now this is conducted every 6 months. This is conducted every 6 months. But why is it called dual? Because it has a part-time enumerator. It has a part-time enumerator, alright, who collects data, and it is cross-matched with a full-time enumerator. It is a part-time and it is cross-matched with a full-time enumerator. That is why it is dual recording. And SRS data released every year. SRS data released every year. Alright, it is released annually. SRS data released every year. Okay? So dual recording system is going to provide you on data on, it tells us about CDR. So SRS gives you data on CDR, gives you data on CBR, gives you data on IMR, gives you data on MMR. Also, it can tell us about annual growth rate of a country. Okay, AGR. That's the points about dual recording. It's the most efficient health information system. Most efficient system, okay, of data collection. It's the most efficient health information collection system. You must know. Population pyramid, literacy rate, sex ratio, all this information you can get from the census. Clear? Alright, next question. NFHS is done in every National Family Health Survey. Another important question. NFHS is done every, when is NFHS done? Good. NFHS is done every 5 years, 5 to 6 years. Completed 5 rounds of National Family Health Survey. Completed 5 rounds. Alright, in old MCQs you will see the answer is 4 rounds, but we have completed 5 rounds now. Last one was conducted 2019 se 2021. It's conducted once every 5 years. And if you've gone through the image-based session, I showed you a photograph of the institute which is responsible for conducting NFHS. Which one is that? Anybody in the comment section? Who has been vested with the responsibility to conduct NFHS, guys? Who has been vested? Who is given the Mumbai? Very good, Likita. Mumbai में कौन है? Mumbai में है IIPS. And check out its image from the image based session. PDF and links, everything is there. International Institute of Population Sciences. Okay, International Institute of Population Sciences. International Institute of Population Sciences. And the headquarter of IIPS is in Mumbai. Headquarter is in Mumbai. Along with Ministry of Health and Family Welfare. वो तो करता ही करता है. But the important institute is this one. Clear? It gives you on data like what is the prevalence of anemia in the country, what is the prevalence of wasting in the country, what is the prevalence of stunting in the country, what is the prevalence of immunization, how much is the home delivery, how many women use sanitary pads, how many people are using internet. All those things is NFHS giving us at national level. Okay? Not true about CRS. What is CRS, guys? Questions to turn up from civil registration system. Can you tell me the answer to it? Alright, of course, dual recording system is SRS. Civil registration system, head of institution or officer in charge is responsible for registration. Wherever the baby is born, they are responsible. Birth and deaths have to be registered within 21 days. And of course, if we are registering birth and death, we will also register the cause of death. And this is least efficient. This is least efficient. Okay? Least efficient system. Most efficient is SRS. Least efficient system, guys, is CRS. And we also record the cause of death. Clear? Okay, let's see this one now. Certain fertility indicators. What will be your answer here? Look at the buzzword. Look at the buzzword, guys. Average number of children a woman would have if she were to pass through her reproductive years, bearing children at the same rates as women now in each group is known as. So what is your answer over here? What is it that you're going to look at? Very good. I've taught you a number of times now. Children. Children is the buzzword for total fertility rate. Children, TFR क्या होता है? Children a woman will have throughout, like right from 15 to 49 years, how many children is she going to have? So average number of children a woman will have throughout her reproductive lifespan. So children is TFR. If I had given you average number of girls, if I had given you girls a woman will have, gross is girls. And if I had given you considering mortality, taking mortality, okay, if I had given you considering mortality, your answer would have been net reproduction rate. Alright, it would have been net reproduction rate. So you have to be a little careful with the buzzwords here. Okay, let's see the other question. Let's see the other. सबको हेलो बोल दो, खेलने जाओ, ठीक है? चलो सबको हेलो बोलो. हाँ, अब बाय बोलो. बाय बाय. अब जाओ. नहीं उसको नहीं. अब जाओ. जल्दी खेल के आओ. Where was I? Okay. Alright, chalo. Let us see the answer. Yeah, he had a haircut. Mundan. Alright, so what is your answer over here? GFR also. Okay. The number of live births per 1,000 women in the reproductive age group in a year refers to. Now, what is the answer over here? The number of live births. What is it per 1,000 women in reproductive age group? So, the answer is general fertility rate. Let me quickly revise with you all of the ones. Okay. पहला होता है CBR. CBR क्या होता है? Total number of live births per 1,000 mid-year population. But CBR is a very crude indicator. Okay? It is the simplest measure of fertility. At least it gives us some idea. ठीक है. उसके बाद आता है आफ्टर CBR. नाउ एवरीबडी इन द डिनोमिनेटर कैन नॉट गिव बर्थ टू अ बेबी. इट हैज़ मेन ऑल्सो, चिल्ड्रन ऑल्सो, everyone. So we will have GFR. GFR क्या होता है? टोटल नंबर ऑफ लाइव बर्थ्स पर 1,000 women in reproductive age group. Guys, I'll just be back. One second. Okay. Chalo. So let us move forward. Yeah, GFR is total number of live births per thousand women in reproductive age group. Women in reproductive age group. Now, women in reproductive age group is 15 to 49. Now, every woman is not equally exposed. Who are more exposed to giving birth? GMFR, general marital fertility rate. Number of live births per thousand married women, alright, per thousand married women in reproductive age group. So here the question was reproductive age group, so the answer is general fertility rate. Okay? Alright, let's go to the next question. What is net reproduction rate? Okay, what is your buzzword for net reproduction rate, guys? नेट रिप्रोडक्शन रेट में आप क्या देखोगे? इट टेक्स इनटू अकाउंट द mortality. Very good. So number of female children a newborn girl will have in her lifetime, taking into account mortality. So net reproduction rate is what? It is mortality dependent. All right, it is mortality dependent. Children that a newborn girl will have, this is number of children, this is TFR. Number of female children, this is gross reproduction rate. And when you consider mortality, that is net reproduction rate. Indicator of complete family size. Indicator of complete family size. So if you have complete family size, it is TFR. Family size क्या होता है? Total number of children. Family size होता है total number of children a woman will have. ठीक है? Don't count the parents in family size. Right from 15 to 49 years, how many children a woman has? That is total fertility rate. Okay, your answer is here, guys. Target couple is what is? Who is a target couple? Can you quickly tell me the answer to this? Target couple कौन है? Okay, I'm getting some answers. Target couple is very good. Target couple term आजकल यूज नहीं होता, ठीक है? Earlier target couple was couple currently married couple wherein the wife is in the reproductive age group. Okay, now this term is denoted to eligible couples. ये हो गया eligible couple. This is what? Eligible couple. All right. Target couple होता है couples with 2 or more than 3 children. Basically, target couple is eligible couple with 2 or more children. Eligible couple with 2 or more children. That is your target couple. What is eligible couple? Eligible couple is simply married couple. They could be newly married. They could have 1 child. They could have 2 children. Alright. It's just that eligible couple wherein woman is in the reproductive age group. Alright, target couple using contraception नहीं होता. Eligible couples are couples that are in need of contraception. Okay, so those like we have to give them, like there are 150 to 180 eligible couples per 1000 population. And where do you maintain eligible couple register? EC register maintained at sub-center. EC register maintained at sub-center, and the responsibility to maintain lies with A&M. Responsibility to maintain lies with A&M. ठीक है? This is also a PYQ. Let's go to the next question. Yeah, contraceptive advice best for newly married couple. What will you tell them? Newly married couple, which contraceptive are you going to advise to them? OCPs, condoms, sterilization, IUD. Newly married, if nothing is written that she's having some heart problem or she's like, if kuch mention nahi hai na guys, तो newly married OCP. Why least failure rate? I mean lower failure rate, because of lower failure rate of than condoms, lower failure rate than condoms. Now of course you can't ask them for sterilization. For sterilization criteria is 1 child more than 1 year. ठीक है? That is a criteria. IUD we don't put in nulliparous. आईयूडी कभी भी न्यूली मैरिड में नहीं लगाना है. नल्ली पैरस वुमेन में इट्स लाइक अ relative contraindication only. We do not use IUDs in a newly married couple. Choice of contraception in a woman who has a heart disease. अब यहाँ पे आंसर क्या होगा? She has a heart disease. So what will you do? You can't give her heart disease अगर है तो क्या आप दे सकते हैं? Heart disease अगर है तो can you put her on Mala and Mala D and all of those things? No. So over here what will be your answer, guys? Now nothing is written. No, married नहीं लिखा. I mean married, unmarried is nothing written. So if a woman has heart disease, what are you going to prefer? Why would you go for condom which has a higher failure rate? I would still go for a IUCD which has a lower failure rate. Try to look at the questions, guys. Heart disease, avoid OCPs. Next in line, it's not written newly married or something. So take the one which has lower failure rate. Which one has lower failure rate out of the boxes? It is IUCD. Clear? But if it was written choice of contraception in a newly married woman with heart disease, all right, newly married women with heart disease, तब आंसर क्या होता? Newly married women with heart disease. तब तुम क्या देते? Newly married women with heart disease. Everybody, newly married women with heart disease is, then what would you have given? Newly married women with heart disease. Then you can, of course, you can't put up IUCDs, you can ask them to use a condom. Clear? So you have to be very careful with the question, what exactly is it asking you? DMPA and all that, of course, they are now provided freely under our National Family Welfare Program. So in any woman who is again having a heart problem, you could go for injection DMPA, but it is associated with certain form of menstrual irregularity. So we are sticking to IUCD. Alright, which is not included in the scope of modern concept of family planning services? What is your answer over here? What do you not do in family planning services? Screen for HIV, good. This is NACP work. We provide sex education under family plannings, education of parenthood. Adoption services also provided under family planning services. Family planning and adoption is a part of it. HIV screening nahi. And please check out the image based session. This is the logo. There is a couple over here. Okay, this is the logo of National Family Welfare Program. India was the first country to start family planning program. India first country to start FP program, to start family planning program. All right, that also you should remember. Okay, now what is the answer to this? Healthy newly married couple, contraception of choice. Can you quickly tell me this? Contraception of choice. What are you going to give or advise for a healthy newly married couple? Yeah, healthy newly married, OCP. Couple in a long distance relationship or who meet occasionally. Considering lower failure rates, we would go for IUCDs. Okay, we will go for lower failure rate over here. So those who meet occasionally, lower failure rate, IUCD. Adolescents, of course, we will ask them to have safe sex using barrier method. So you can ask them to use a condom. Breastfeeding woman within 6 weeks of delivery. What is your contraception of choice now? Progesterone only pill. Because IUCD can be inserted up to post delivery. Alright, it can be inserted up to 48 hours. Alright, inserted after up to 48 hours, or after 6 weeks of delivery. After 6 weeks of delivery. इसीलिए now the answer is not IUCD because we can't use it between 48 hours and 6 weeks. So you should remember this is a go-to slide for exams. Next one, just a couple of things we have discussed. ये वाला जो image है, this is a male condom, alright. This one over here with 2 rings is a female condom. I have already discussed this in image-based session. Remember, this is provided freely by National AIDS Control Program, provided freely by NACP. ठीक है, NACP, discovered by MD Hessel. Does protects from HIV STD. प्रोटेक्ट्स फ्रॉम HIV STD, ठीक है, उससे प्रोटेक्ट करता है। दिस वन ओवर हियर इज द डायफ्राम and this one over here V shaped, these two, they are vaginal sponge. Vaginal sponge is available under the brand name of today and it contains the spermicide non-oxynol 9. What does it contain? Non-oxynol 9, ठीक है। It should be inserted prior to sexual intercourse, left for 6 hours later also if somebody forgets to take it out, can lead to toxic shock syndromes. You must remember these points. Does not protect from HIV STD. No protection from HIV STD. ठीक है, no protection from HIV STD. But you know, diaphragm you can advise to educated females, alright, educated females. It has lower failure rate than vaginal sponge. Clear? Okay. Sexually active woman has been using today's sponge as a contraceptive. All are correct statements except, what is your answer over here? Contains spermicide non-oxynol 9, yes. Should be left in place for 6 hours after coitus, yes. Protects from HIV STD, no. No protection from HIV STD. It can be reused. Today, diaphragm, all of these can be reused. Next question, mini pill. Mini pill क्या होता है? It is a contraception of choice for now for lactating females within 6 weeks of delivery, okay, within 6 weeks of delivery also we give progesterone, okay, only pill, we give a POP, not menstruating women, POP. Also mini pill, this is a contraception of choice, women 40 and above, alright, women 40 and above, if they want a pill, that is what you can advise them, because it has only progesterone. Heart problems are due to estrogen, so we avoid that beyond 35 years. So if they want a pill, put them on POP. Okay. In case woman on OCP forgets to take pills on 3 consecutive days, what should she do? This is an important question. Management of missed pill. Take 2 pills each for the remaining cycle. Take 3 pills the next day. Then continue with 1 pill per day. Use barrier method for the rest of the cycle. Continue with the next pill the next day onwards. Now, see, now the important thing is that she forgets to take pills on 3 successive days. So we'll just read how do you manage to miss pill. If a woman misses 1 to 2 pills, alright, she can, no problem there. She can take 1 pill as soon as possible, or she can take 2 pills at the scheduled time. Like she missed today's pill and yesterday night, tomorrow night if she remembers, she can take 2 pills together, no risk of pregnancy. But if she misses more than 3 pills, 3 or more than 3 pills in the first or second week, then she has to take 1 pill as soon as possible. She'll not pop in all the 3 pills, all the 4 pills. She'll take 1 pill, continue with the schedule, 1 pill as soon as possible, jitni jaldi yaad aa jaye, take her continued scheduled pill, but she has to use a barrier method for the next 7 days, and in case she had unprotected sexual intercourse in the last 72 hours, she will have to use what? She will have to use an emergency contraception, okay? But if she misses in the 3rd week, all she has to do is she will take 1 pill as soon as possible. She will finish all the leftover scheduled pills, but she will discard the non-hormonal pills and start a new pack the next day. In the meantime, she has to use a barrier method for the next 7 days, and in case of unprotected sexual intercourse, okay, she has to use a emergency contraception. She has to use a emergency contraception. If she misses non-hormonal pills, that's okay. Nothing to worry about it. Clear? And if she is having diarrhea or vomiting, then she can just take another pill. Okay, this is management of missed pill. The problem arises when she misses 3 or more than 3. In that case, we have to use a barrier method for the rest of the cycle. And in case somebody had unprotected sexual intercourse during that time, they will have to use a emergency contraception. Got it? Everybody give me a thumbs up for this question. First, second week में iron pills खाना है. Third week में if somebody is forgetting, they have to discard the iron pills also. Okay, non-contraceptive benefits of combined OCPs to a woman are all except. Yeah, Maya, you can stick to that and check out the LRR which was conducted on Prep YouTube or the image based session, whichever you want. Okay, non-contraceptive benefits. It does not protect against cervical cancers. OCP, increased risk of two cancers. Okay, increased risk of definitely cervical cancer, and also a little bit of research is going on this, but as of now they do increase the risk of cervical cancer, breast cancer, but they are protective for endometrial and ovarian cancer. I'll write over here protective. All right, protective. OCP, protective for endometrial and ovarian cancer. Endometrial and ovarian cancer. Protective of endometrial and ovarian cancer. Okay, endo OCPs can be advised safely to a woman in which of the following conditions? Will you give her in breast cancer? No, it increases the risk of breast cancer. Hyperlipidemia, again no, because of progesterone these things happen. Liver disease, no. PID में contraindication is IUCDs. Okay, IODs, they are contraindication for PIDs, not OCPs. You can give in PIDs. Alright, see, remember this one, absolute contraindication of OCPs. You must know absolute contraindication of IUCDs and OCPs. So, breast cancer, genital means cervical cancer, C same. Cardiac abnormalities, congenital hyperlipidemia, undiagnosed uterine bleeding, liver disease, thromboembolism, present or past, they are all absolute contraindications. Okay? Okay, what is the answer over here? This is Mala N. So read about it. Which out of the following statements is incorrect about the given image? Okay, so most of you are writing AC. Now, देखो, which out of the following statements is incorrect about the given image? It protects against benign breast disorders. That is correct. It does not protect against breast cancers. It contains levonorgestrel, ethinyl estradiol. Value you have to know. Levonorgestrel 0.15 mg, ethinyl estradiol 0.03 mg. Provided free of cost under National Family Welfare Program. Of course, Mala N over here is health program. Increases risk of endometrial cancer? No, it is protective for ovarian and endometrial cancer. It is protective. So I just twisted the question a little. You should read about it. Mala N, Mala D. Mala N is provided freely. If you look over here, this is Mala D, which is provided as a part of social marketing scheme. But the composition of levonorgestrel and ethinyl estradiol is the same. You should remember levonorgestrel is 0.15 and ethinyl estradiol is 0.03 and estrogen ही heart effects कराता है. ठीक है? चलो, next question, drug of choice, emergency contraception. What is the drug of choice, everybody? So all of you know it is a single pill. Now it is a mini pill, I pill, whatever, easy pill, whatever you say, mini pill, I pill, easy pill, unwanted 72, not mini pill, I mean I pill, easy pill, whatever you want to say it. So the answer to this is, everybody, levonorgestrel uni pill 1.5 milligram का single tablet है, which has to be taken within 72 hours. Now initially before this, YASP method was very famous. YASP method is combined OCP. We can use ulipristal, सिलेक्टिव प्रोजेस्ट्रॉन रिसेप्टर मोड्यूलेटर 30 मिलीग्राम का टैबलेट यूज होता था. मीफेप्रिस्टॉन, नाउ डोजेस 10 milligram. Okay, IUCD is the best. Can be used up to 5 days. Can be used up to 5 days of unprotected sexual intercourse. Can be used up to 5 days. Okay, it can be used up to 5 days of unprotected sexual intercourse. ठीक है, but the most commonly used is, of course we know the most commonly used is which one? I pill. Alright, characteristics. Who's an ideal IUD candidate? Has born at least 2 children, is willing to check IUD tail, has history of ectopic pregnancy, has normal menstrual periods. Yeah, Ulipristal also for 5 days can be used, but it's not that effective. See, ideal IUD candidate is menorrhagia is a relative contraindication, right? Menorrhagia is a relative contraindication. Ectopic pregnancy is a relative contraindication. आप लगा सकते हो. Now, is it that somebody needs to have 2 children for IUD? Is it written somewhere that somebody needs to have 2 children, has born at least 2 children, has born at least 2 children? No. Characteristic could be except. So not 2 children, has born at least 1 children. We can put an IUD in that person also. Willing to check IUD tail? Yes. Has a history of ectopic pregnancy? That's okay. Even if the person has a history of ectopic pregnancy, we can go and insert a IUD over there. Alright. Has normal menstrual? That's okay. Clear? So characteristics as born at least 2 children is not this thing. We can have an IUD also when the person has born at least 1 child. Clear? Okay. Let's go to the next one. Calculate couple protection rate over here. What is the answer over here? Calculate couple protection rate. आजकल ectopic pregnancy is a relative contraindication. You can insert an IUD. Okay, do this. We'll go back to that question once again. Alright, we'll go back to that question once again. Can you solve this one, everybody? A village has 180 eligible couples, out of which 10 couples use OCP, 29 couples use condoms, 10 couples use IUDs, 3 vasectomy, 8 tubectomy. What is CPR? Couple protection rate. क्वेश्चन लिखा आइडियल. ठीक है, आइडियल में ये नहीं है कि 2 चिल्ड्रन होंगे तो ही आइडियल है. 1 चिल्ड्रन में भी आईओडी लग सकता है. ठीक है, सो वी आर जस्ट गोइंग फॉर द बेटर ऑप्शन आउट ऑफ द फोर्स. Okay, what is your answer here? Yeah, couple protection rate means all the couples using eligible couples protected using contraception method, protected out of the total eligible couple, and it is into 100. So you have a village has 180 eligible couples, out of which 10 couples use OCP, 29 use condoms, 10 use IUDs, 8, 9, 10, 11. ठीक है? So how much does it come? 60. Alright, so into 100, of course you're going to do it. So what is your answer over here, everybody? Good, it is 33. You can just calculate this and you can see how much your answer comes to. Everybody got 33.3. That's okay. This is couple protection rate. And you all know that for a country's population to stabilize, population to stabilize, what should be the TFR, guys? Desirable TFR should be 2.1. This means we have attained the 2-child norm. This is possible when out of those 2 children, 1 is girl. NRR is 1. That means 1 woman is replacing herself exactly with 1 child. And this is possible. This is replacement level of fertility. ठीक है, ये क्या है? Replacement level fertility. And this is possible when couple protection rate, everybody, is more than 60%. More than 60%. 66 मत बोलना. India में currently it is 66.6% something. But couple protection rate has to be how much? Couple protection rate has to be more than 60%. Am I clear? Everybody would be able to do this one? ठीक है, everyone would be able to do this one, guys. चलो, where did you disappear? Yeah, got it? India का current TFR is 2, but if anybody asks you desirable TFR for a country is 2.1. Okay, which of the following IUDs are provided freely? Just put the options. कौन से freely दिए जाते हैं by Government of India under National Family Welfare Program? Can you tell me the answer to this, guys? Which are provided freely by Government of India under the National Family Welfare Program? A and C. Very good. Copper T 380A, shelf life 10 years. I have just discussed this also in image based sessions. Copper T 375 multi-load. These are provided freely by Government of India. Okay? This one over here is Myrina LNG 20. This is not provided freely by Government of India. Okay, this you all know Myrina 52 milligram of levonorgestrel होता है. This one has the least failure rate, okay, but they are not provided freely. Least failure rate, third generation. This one is Progestasert. Progestasert. This is what? First generation, third generation, but this has the least expulsion rate. What does it have? Least expulsion rate. और इसकी जो shelf life है ना, that is only for 1 year. India में it's not that available also. ठीक है? It has a shelf life of 1 year. Clear? Everybody got it? Everybody, did you understand this question? Okay. Let's go to the next question, guys. Just a couple of more questions. What is the answer to this? You have to give me 1 second, okay? Something I have to open. Just 1 second, guys. Can you answer this question, please? वेरी गुड. हाँ, रेडियो ओपेक मटीरियल क्या लिख रहे हो? ए बी. ए नहीं है. रेडियो ओपेक मटीरियल. रेडियो ओपेक मटीरियल इन कॉपर टी इज बेरियम सल्फेट. दिस इज अ वेरी एज ओल्ड क्वेश्चन, गाइज. It's like, you know, it's like the frame of it has radio opaque material, barium sulfate. That is why it could be spotted in an X-ray. ठीक है? Alright, going to the next question. What's the answer to this? Absolute contraindication of IUCD. Can you tell me the answer? Absolute contraindication of IUCD, guys. Yeah, put in your answers. Absolute contraindication. Is it anemia? Is it anemia? Is it diabetes? Is it hemorrhage? Is it PID? PID. Very good. Absolute is current PID. Relative is past history of PID. Anemia, hemorrhage, they are all relative contraindication. Okay? So this you know, we've discussed contraindications many times. I just want you to remember one more thing, guys. Relative contraindication. Okay? Relative contraindication is previous ectopic. Previous ectopic pregnancy is now relative contraindication. Previous ectopic pregnancy is now relative contraindication. Clear? Okay, most common side effect of IUD insertion which requires its removal is, let's see your answer, bleeding, pain, pelvic infection, ectopic pregnancy. What are you writing? They go, how will they trick you? Some of you are writing A. A answer नहीं है. A किसका answer है? Most common side effect. Alright, A is most common side effect of IUD insertion. But the question here is which requires its removal. What is the side effect, most common side effect or most common cause of removal of IUD? It is pain. I didn't ask you most common side effect of IUD insertion. I added a line which requires its removal. Removal के लिए the most common thing is pain. So don't immediately see most common side effect and answer becomes bleeding. No, the question was changed. It said which requires its removal. So that is pain. right? Okay, at PHC level, so be careful with the question. At PHC level, a woman who complains of spotting following IUCD insertion, what are you going to advise to that woman, everybody? What are you going to advise to that woman? Would you immediately remove the IUCD? Would you give iron supplements? Would you give antibiotic, analgesics and observe? Very good, very good. It is iron supplements and observation. This is actually physiological thing. It gets better on its own by 2-3 months. So all you have to do is you have to reassurance. Okay? Most common side effect is bleeding. Most common cause of removal is pain. Alright, a sexually active woman is using contraceptive Antara. Antara kya hai? Antara is nothing but injectable DMPA. Antara is nothing but injectable DMPA. It has to be used 150 milligram every 3 months. Okay, if a woman comes 2 weeks before or 2 weeks later, we don't have to worry, we can still give her the injection. The only problem with Antara and all this is, no, it leads to menstrual irregularities a bit. Otherwise its failure rate is not very high or something. It could be used, and now it is provided freely and by the government of India, provided freely. Okay, this is your Antara. It could come in your exam. It is provided freely, 150 milligram intramuscular. Okay. Another friend of Antara which is provided freely is, guys, Chaya, centchroman or meloxifene. It contains the chemical or meloxifene, okay, or meloxifene. This is a one, you have to take it twice a week for the first 3 months, then once a week after 3 months. So this is known as once a week pill, and it is now available as Chaya. So two friends, Antara and Chaya, are freely available under Government of India, National Family Welfare Program. Okay, coming to last two things. What is the Pearl Index of Contraceptive X? Can you calculate and tell me in the comment section? Megha, you can put it within 48 hours. Okay? Either use it within 48 hours or after 6 weeks of deliveries. Earlier we were using it between 48 hours and 6 weeks also. Now we can't do that. Now, Pearl Index. Pearl Index is the most common method to evaluate, what? To evaluate contraceptive efficacy. Now, in Pearl Index, formula क्या होता है? Total number of accidental pregnancies divided by the total months of exposure multiplied by 1200. 1200 because 1200 is the number of months in 100 years. अब यहाँ पे कितने accidental pregnancies हैं? 20. How many couples have used? 100 couples. Total months, 1 year has 12 months, so 2 years has 24 months into 1200. So this is 10 per 100 woman year. 10 per 100 woman year. The answer is 10 per 100 woman year. But the best method to evaluate contraceptive efficacy, please remember, best method is life table analysis, or a better method. Okay? Life table analysis. Most commonly we use Pearl Index, and that's the formula. Never forget to, multiply these couples. बहुत बार एग्जाम में क्या होता है, we'll just use in the denominator 24. No, you have to consider how many couples are also using. Got it? Okay. For medical termination of pregnancy, consent from whom is necessary, guys? For medical termination of pregnancy, consent from whom is necessary? MTP Act you can study from forensic. Just 1 or 2 points I will tell you over here. MTP के लिए husband and wife नहीं. Consent from pregnant mother irrespective of her age. If she is 16 years, does she work? No. Then in case legal guardian, consent from pregnant mother provided her age is more than 18 years. If she is less than 18 years, we need the consent from her guardian. ठीक है? One more thing, in case of contraceptive failure, MTP can be done till 20 weeks by the help of one doctor. 20 to 24 weeks में 2 डॉक्टर चाहिए होता है. The reasons are different. 20 to 24 weeks में 2 doctors, and beyond 24 weeks if needed, okay, beyond 24 weeks it has to be reviewed by the state medical board if it is endangering the life of the mother or some severe congenital malformation has been detected. Clear? MTP Act, do go through it thoroughly. Okay, last couple of things guys. Nishchay, you all know, is free UPT kit. Free UPT kit provided by ASHA worker. Mission Parivar Vikas is another thing which has been adopted by National Family Welfare Program. See, ये है Mission Parivar Vikas, ये इसका logo है. Family Welfare Program has adopted this. In this, we have something known as Nai Pehel, family planning kits we are giving to the couples. Saas Bahu Sammelan to improve their relationship. Sarthi, family planning mobile vans are also there. You could be asked in the exam, Sarthi is for what? Leprosy, TB, family planning. So it is a family planning mobile van. All of this, and also in this only you have newer contraceptive. Okay? In this only you have newer contraceptives, Antara and Chaya. ठीक है. निश्चय is free UPT kit, free UPT kit. And जनसंख्या स्थिरता कोष क्या होता है? कहाँ जा रहे हो? स्थिरता कोष is what everybody? National Population Stabilization Fund. Okay, it's written over here. National Population Stabilization Fund. National Population Stabilization Fund. So you should know that it's Jansankhya Sthirta Kosh is a fund to maintain the population. Clear? Everyone got these things? ठीक है? Nishchay, free UPT kit. Nikshchay is for TB patient, and Nikusht is for leprosy. Last image, which image is this? So a couple of questions related to this which could come guys. Vasectomy. Now vasectomy, the person is not immediately sterile, has to use a barrier method for 3 months. Barrier method use करना है for 3 months, or 20 ejaculations free, not 30. 20 ejaculations free. Most common cause of failure, misidentification of vas. Most common cause of failure of vasectomy, failure क्या है? Misidentification of vas. Misidentification of vas. Vas deferens का कितना centimeter has to be cut ligated? So it is at least 1 centimeter ligate. Okay, at least 1 centimeter. And for criteria for vasectomy and tubectomy, all right, criteria, चाहे vasectomy का हो, चाहे a woman has to undergo tubectomy, they all have to have one child more than 1 year age. ठीक है? Not 2 children, one child more than 1 year age. Clear? Everybody, we don't need approval from the husband or the wife for this one. So that's it for today guys. I hope you all are revising. I hope you all are studying. Please don't give up. Don't think कि questions यही PYQs ही हैं guys. We are sticking to that only so that I'm just helping you revise your PYTs. So you know that okay, the questions have come from these topics. You do not have to make a mistake guys. And tomorrow is a class on environment. The quiz will be at 8 p.m. Do attend it. Tomorrow environment. So I will see you tomorrow everybody at 12 p.m. And don't worry at all. Keep attending, keep revising. Go through the image based session also which is there. I think you're good to go with. Okay. Yesterday topic, can we take it up tomorrow? You can send me on Telegram or somewhere. Yes, it is good for UPSC also. If you follow this daily class, of course, it would be really helpful for you. I'm looking on the other screen this side, okay? If ऐसा नहीं होगा भक्ति, you can use it within 48 hours also or after 6 weeks. 48 hours and 6 weeks, they would not give you as separate options obviously. Quiz at 8 p.m. LRR, PDF as well as the link is on my Telegram group. Okay. Bye-bye. Have a good day. Keep studying. Keep revising. Thank you so much. All right, everybody. Yeah. So I will see you